Hi Terry. This is not one of the many marriage proposals that you have undoubtedly received in response to your videos. And this is for two reasons. One is I'm madly in love with my wife, and two is I actually get my health insurance through her job. What I wanted to do though is to share with you some information that may help you, may help some of your viewers who have pre-existing conditions. I've been in the insurance business since 1985 and just wanted to share some information with you. Now the first few tips are not going to apply to you, so if you just bear with me, but they may be useful to some of your viewers. Number one, if you have health insurance, never drop it in order to get a second policy until you've gotten the approval from the second company. And this should be the case no matter how healthy you are, because you can be healthy today and fall down a flight of stairs or be hit by a drunk driver tomorrow. So always hold on to policy A until policy B gives you the approval. Now if you are turned down or you get an answer that you don't like from an insurance company, continue to shop around. You may even want to take that policy. With most individual policies, you can drop it. You can drop it after 1 month. So you may want to take the policy that didn't give you the answer you wanted or charges you too much, and continue to shop around. Not all companies are going to treat all pre-existing conditions the same way. This happens every week in my practice. I'll find that company A charges more for a particular condition or will exclude that condition, but company B will give the person standard rates and give them full coverage. Now, if you've been told no by all the companies, don't assume that a no is a no forever. As certain conditions age, insurance companies will look at them more favorably. If you were just diagnosed with XYZ yesterday, a company may say no. But if you were diagnosed with that condition a year ago and you have shown that whatever medications you were giving or lifestyle changes you employed have made that condition better even though it didn't go away, then the insurance companies may look at that differently. And also, if you are denied, you should find out where the line is drawn. It may be that you're 10 pounds overweight. It may be that if your condition aged one more month, that they would say yes. So find out if they're going to say no forever, or if you're close to the guidelines. And the most important thing that the average person can do to make sure that they keep their health insurance costs down is to stay healthy. And this doesn't directly affect those who have pre-existing conditions, but I think that for those of us who can have impact on our health, I think that we have an obligation to those who can't, not to overburden the system and make it difficult for those who will have various conditions that they don't have control over. But by burdening the system, we make it more difficult for people like yourself to get coverage. Anyway, so moving on, there are perhaps options for people like yourself, Terry. One is you may want to start a business. In most states, if not all states, a group of two will qualify for group insurance rates, and I don't believe you can be turned down for a group insurance policy. In some states, you can get a group insurance policy with just one employee, with just yourself as an employee. You can also look at plans available through various parts of the government, whether it's federal, state, county, or city or town. And one way to look for that is to go to Google and click on the advanced search link. Type in a query such as guaranteed issue health insurance Connecticut, or whatever your state is, in that top box. And then if you go look down a little bit farther, there's a box that says something like limit search to a domain. And in that box you're going to type in .gov. .gov. And when you do that and you click search, you're going to limit the results that you get to government-based websites. I have a website. I cannot get a Gov website because I'm not a city. I'm not a state. I'm not the federal government. So you won't get results from companies just trying to sell you health insurance, like my website, lovetherates.com. But you'll get information from the government that should be a lot more reliable and hopefully helpful to you. There's a book called The New Health Insurance Solution that may be helpful to you. It goes into ways to get coverage when you've been denied before. The book has a copyright date of 2007, so it's a little dated. They do have a website, which is the initials. It is tnhis.com, and there you can see a state-by-state breakdown of what's available as far as a guaranteed issue and so forth. But that's even more dated. That's 2004, but it may be a good, easy starting point. So, Jerry, I really hope that either some of these tips help you, or you are able to find true love packaged with a great health insurance policy. I wish you all the best, and I really think that you shouldn't have to marry to get health insurance, and that is a sad state of affairs that this country, as great as it is, does not do better for people who have medical conditions due to no fault of their own. So I wish you the best, and again I hope that I just wish you the best. God bless you. Bye-bye.